Lisa with Specialty Wellness.
Hi, I'm Samal.
And today we're going to talk about treatments for acne. So Samal, why don't you kind of go through the process of if a patient has acne, what's the whole process like?
So we like to start off with a consultation. We like to aim to have all of our patients come in for a consultation. They meet with our board certified physician assistant, Lisa, and we kind of just figure out what the patient is really trying to target. Some patients like to tell us that they have cystic acne, hormonal acne. Some people are just wanting to just have medication prescribed to them, but we can also go more on the med spa route as well. We have different options that we can kind of start off with. There's always microneedling options, there's HydraFacials. Sometimes chemical peels also help, correct me if I'm wrong.
Yes, yeah.
But there's multiple areas that we can kind of target with which service we're really looking for, but it also really does depend on what the patient feels comfortable with.
So yes, basically we kind of figure out what kind of acne they have, where is the acne coming from, what's causing the acne. And like Samal said, since we are a primary care office here, we can prescribe doxycycline, certain type of antibiotics, topical acne medicine if needed on our medical side. But if the patient has already tried that or doesn't want to do that and wants a more like natural way to kind of get rid of the acne and clear the acne or clear the acne scars, then we can head them over to our fun med spa side and find a treatment that helps them the most. So typically kind of what she said, the best kind of initial treatment for acne is starting with the HydraFacial. The good thing about a HydraFacial, it's a medical facial that's going to suck out all the dirt and oil and impurities and bacteria that's in your skin that might be causing your acne. It also has different kind of skin boosters, and there actually is one for oily skin and acne that we recommend for all of our acne patients or even acne prone patients. In the deluxe HydraFacial, there's the add-on of the LED blue light therapy, which blue light actually kills the bacteria that can cause acne. So that's perfect for someone with acne, with active acne, acne prone, has a history of acne. That way the bacteria that's causing the acne can be killed during that treatment. A little bit more of an aggressive treatment would be chemical peels. There are certain chemical peels that are actually made for acne skin, treating the acne, killing the acne, and helping prevent any hyperpigmentation from acne as well. We have VI peels here, which is a great medical grade peel that is great for treating acne.
She's spot on. That's all I have to say. She does everything.
Have you tried acne peels before?
I have done the chemical peel before once. I haven't tried the VI peel certainly, but I have done the AHA, BHA, I believe that's what it's called. I've done that and I really loved it. I personally have acne prone skin, so I saw a very big difference in my own skin, not just the acne wise, but a glow to the skin. It was really bright and refreshed, and I enjoyed it, and I continue to keep doing it. I switch it off, HydraFacial, chemical peel, and I kind of go back and forth. Here and there, I'll throw in a microneedling as well. So I kind of just play around, and I've seen a difference. So I love it.
Awesome. Yeah, so if they've done the HydraFacials, they've done the chemical peels, kind of the next step up for acne and acne scars especially is the microneedling, or even better, the RF microneedling, which is radio frequency microneedling. So you're going to get collagen stimulation, skin rebuilding, skin remodeling to help with the pitted acne scars, the texture acne scars, the pigmented, the brown spots, red spots, pink spots, whatever kind of spots you have after acne. Those kind of laser treatments are going to help clear up any kind of scarring as well.
Only thing I would like to add is people kind of get scared with the pain. They hear microneedling and needles. But one good thing that we do over here is that we have lidocaine that we apply all over the face for at least 30 minutes. And then from there, you don't feel a thing. So it's actually a compounded numbing cream. So it's benzocaine, lidocaine, and tetracaine.
Okay. So it's like long acting and short acting and mid acting. So it's going to work really well. And if that doesn't work, we also have laughing gas. If that doesn't work, we have a cool fan. So there's a lot of different things to help with the pain. So honestly, the pain is not as scary as one would think, thinking RF microneedling, needles to my skin. It's actually not that bad. I've honestly never had a patient tell me like, stop, I can't do this. So for the most part, it's actually pretty comfortable with the numbing medicine we have here. If needed to, we can inject lidocaine into the skin to numb like the really problem areas and areas that we really want to go deep on. We can actually inject lidocaine, and that way you feel absolutely nothing. And then downtime wise with RF microneedling, I mean, honestly, since the radio frequency heat kind of stimulates the collagen and the work is done deep in the skin, you only have about like 1 to 2, maybe 3 days of downtime. So it's honestly not that bad downtime wise. Of course, HydraFacial, no downtime, no pain, and chemical peel. You'll be peeling, but you won't really have like severe downtime.
Yeah.
Or pain. The nice thing about the VI peels too is there's actually a numbing agent in the VI peels, so it actually numbs your skin so that you don't feel any of the pain or the burning.
Mm-hmm. Yeah, I think you got it pretty much spot on. And we also give you a little kit, a to-go kit to take at home.
Yeah. There's with all the VI peels, you get a take-home skincare kit that has your cleanser, your SPF, cream to help with like hyperpigmentation and, getting your skin like prepped for the whole healing process. Another way to elevate your acne scar treatment is adding in PRP. That is best when you add on the PRP to the microneedling or the RF microneedling, basically because during the microneedling process, you're making micro channels in the skin. So that leaves an entryway for the PRP to get soaked up into your skin. And what PRP is when we draw your blood, spin it in our little centrifuge, and we get all the plasma, which is full of the growth factors. And then we can either inject it into the acne scars, or we can put it just topically on after the microneedling. So the PRP is going to help your body heal faster, and then also just boost your results because those growth factors are going to stimulate even more collagen and elastin to help repair your skin for the acne scars.
They also say that the plasma that you have at the top of the tube is your liquid gold.
Yes.
And that's honestly gold on your face.
Who doesn't like gold?
I agree.
Yeah. Aftercare, we always just tell patients, like, be gentle with your skin. If you are using some kind of like acne topical medicine, definitely start a couple days before your treatment and then wait till your skin's fully healed to restart those topical agents. And of course, protect your skin from the sun as with any treatment, because this is basically new, fresh, smooth skin. You want your skin to be protected. Mineral-based sunscreens are usually the best and usually help with acne-prone skin versus like the chemical-based sunscreen. Sometimes those can be irritating and kind of cause like a stinging sensation after doing the treatment. But the mineral-based is a more like natural approach to the sunscreen as well. And then avoiding makeup for at least 24 hours. You definitely want to do that. Otherwise, you could get like little tiny breakouts. And moisturize your skin is important, but don't like overly moisturize your skin because sometimes that can cause little breakouts as well.
So since I have acne prone skin, how many treatments do you think I would need for my?
I would say probably 6, but I would say let's start with 3 treatments of either the chemical peels or the RF microneedling, see how it goes. And, if you're happy at that point, then maybe that's good to go. We just put you on a maintenance plan. But I think maybe 6 treatments would be better just to get your skin like super clear.
Okay.
And then, so that's how it kind of works with every single patient. Every single patient who comes in, we listen to their concerns, figure out what's the best treatment for them, for the results they're looking for. And then we make a customized skincare plan for that patient specifically. And usually that includes a combination of HydraFacials, some kind of like chemical peel, skin resurfacing, and then some kind of skincare for them to do at home. Because the last thing we want is for you to spend all this money and time coming here and doing all these treatments and then going home and using not good skincare, because the skincare that you use at home is what's really going to help prep your skin, keep your skin healthy, and then help prolong your results and maintain your results as well.
And it's best to use medical grade skincare,
yes,
right? Like
yes.
your SkinBetter, I believe.
Yes. So my favorite SkinBetter and SkinMedica, those are my favorite medical grade skincare. And kind of the difference is all of the medical grade were actually like medically tested, clinically tested. They did trials, they had placebos, they had the live product just to see, does this actually cause any problems and does this actually have results? And everything on the market in the medical grade skincare has been proven to get good results. Where when you get something like Neutrogena or oil of Olay, it's just like a product they put on the market. And when you get products like Neutrogena or oil of Olay, those are just, commercial grocery store brands that aren't really proving to have done anything successful.
Yeah.
Even if there's a retinol in it, it's not like a medical grade retinol or even like a retinoid, like a Retin-A or Tazarac or anything like that.
I agree. And that's why I personally have Lisa prescribe me tretinoin, because I personally feel like I feel a lot better having a prescription that I'm actually picking up rather than buying something off of Target or, the Korean skincare that they have out now. So I like to use more medical grade. So I personally choose tretinoin and SkinBetter. SkinBetter also has a lot of retinoid, I believe, that I've seen. So I try to switch back and forth with those two.
Yeah, the nice thing with SkinBetter is they have 3 different types of alpha ret. That's their retinol product line. They have the regular one, they have the intensive for someone who's a little bit older who just wants more of a stronger retinol concentration. Then they have the clearing serum alpha ret, which is more acne prone. It has a little bit of salicylic acid added into it. So there's 3 different SkinBetter options as well.
Yeah. And one thing I do like about the HydraFacials is because it kind of adds in all of those retinols that we're having that, and it's injected into, not injected, but it's like kind of
infused.
Yeah, that's the word I was looking for. And so within the deluxe that we do have salicylic acid, we have
glycolic acid, beta.
We have a good amount, and it really helps. And when I see patients come in when they're checking in for their appointments versus once they're leaving, there's a huge difference in their skin, a really huge difference. Yeah. And then I like the before and after pictures.
Yeah,
because that's personally before I book with someone, I like to see their before and after.
Yeah, we have so many successful patients, especially with acne or acne scars, who have come in and like their skin has just dramatically changed, and they're super happy. And like, of course, that makes us happy, but it just changes their life because they've been dealing with acne their whole life or acne scars their whole life, and now their skin is like fresh and they don't have to wear makeup, and their confidence has been boosted so much. So that's always
definitely
great to see.
Definitely,
and great to be part of like that journey.
Right. Yeah. And then sometimes you'll have the other side of patients where it's like, I just did a HydraFacial and I'm breaking out, which is completely normal because we're basically clearing that gunk out,
purging it out.
Yeah, and so it's going to come to your surface level, and that's you'll clear all of that out. But that's just it's a normal thing. So
it's like a detox that happens to some people,
right?
If you are more acne prone or breakout prone, just tell Mandy, our HydraFacialist, because there's actually different steps she can change in the HydraFacial to help you not hopefully break out as well. So,
yeah,
great. All right. So if you are interested in acne treatment or acne scar treatment, please call us and make a consultation with me. Samal will happily answer the phone and schedule you. And we would love to see you.
Bye.
Bye.